Good afternoon. I am Dr. Avijit Royzada, consultant physician, hypertension, diabetes and kidney specialist. I have focused for last 22 years in the management of diabetes and hypertension. Hypertension is a major killer in our society. If you say 70 to 75% of the cardiovascular disease, intracerebral bleed, stroke, chronic kidney disease and blindness can be devoted to hypertension. India is number 2 in the total number of hypertension. Nowadays, a lot of awareness programs are going on for the management of hypertension. What is hypertension? Hypertension is the blood pressure which is created by when the heart pumps and presses the blood into the vessels, and the pressure generated to the arteries wall is called the blood pressure. Normal blood pressure is 120 by 80 with a variation from 110/70 to 130 by 85. Any blood pressure which is more than 135 by 85 is called hypertension. Upper is called systolic blood pressure and the lower is diastolic blood pressure. The upper blood pressure systolic is created by heart's blood pump into the vessels, and diastolic the heart relaxes and pulls the blood back, that is called the diastolic blood pressure. Both the systolic and diastolic blood pressure should be up to a mark. If it is going high, it is called hypertension. If it is low, it is called hypotension, and normal blood pressure is called the normotension. Why the India is called the capital of hypertension? Because 2/3 of the blood pressure patient, they never achieve their goal. That means once we are treating, once we are diagnosing, we should know what are the preventive and what are the treatment factors. Prevention is very, very important. For example, a young person dies of hypertension because of the intracerebral bleed or chronic kidney disease, then his relatives, brother, son and daughter should be screened very early. Hypertension is very easy to diagnose. Everybody who is more than 20 years or 15 years also should know their hypertension, that means their blood pressure levels. Once the family history of hypertension is there, we should have a screening programs like renal artery Doppler, ultrasonography, electrocardiography and microalbuminuria. We all know that if the hypertension is not maintained, then it is called silent killer because there is no pain, no breathlessness, nothing. But in 15 to 20% of the patient, fatigue, blurring of the eye, dizziness in the ear, giddiness or weakness or fatigue while going upstairs can be there. Most of the hypertensive patient, almost 2/3, they die of the cardiovascular disease, stroke, acute myocardial infarction, cardiac failure, intracerebral bleed and ischemic stroke. That's why it is very important to screen early. How to prevent the hypertension? In young age, isotonic exercise like 40-minute walk can be a very good preventive aspect. Whenever a person is very regularly acclimatized, then his vagal tone goes down, his heart rate becomes 60 to 70 and their arteries become very, very strengthened, and that's why the myocardial muscles also gets strong. So it's very message is very clear of Indian Society of Hypertension and Coronary Artery Disease that every young person who is getting married or going for the insurance must know that his blood pressure is normal. During the insurance also it is a protocol that hypertension should be screened out. Below 40, it was previously assumed that hypertension is a disease of 40 to 45, but in last 2 decades we have seen less than 30 years also. What are the causes of hypertension? First factor is the stress factor. Nowadays the software engineers, they don't have routines. They are not doing their works, they are eating, they are sleeping, they are walking etc. according to a routine. Secondly, night risers, that means those who are not sleeping properly in the night, if the sleep pattern is not proper, then the blood pressure is going to happen. Thirdly, the salt intake. All the metro cities, the software workers or the routine workers, they are eating outside. The hotel food, packed food or the food filled up with the salt and the preservatives may be a very good add-on factor. In 70s or 80s, the hypertension was less than 10%. But now the event is increasing to 15 to 20%. That means 1 out of 5 person who is above 40 years is hypertensive. And thirdly, most importantly, we should avoid our alcohol and smoking. These are called the iatrogenic or the drug-induced type of hypertension. Fourth is idiopathic hypertension. They don't have any causative factor. While screening for ECG, ultrasonography or doing ambulatory BP monitoring, hypertension can be very well diagnosed. And important is the target organ damage. That means the blood pressure is not controlled, the heart can be damaged, the brain can be damaged, eyes can be damaged and kidneys can be damaged. At the same time, peripheral artery disease, the diabetes and hypertension are like the brothers and sisters. Whenever we are screening for diabetes, we should search for hypertension also. Almost 1/3 of the diabetic patients, they are hypertensive, and almost 1/3 of the hypertensive patients are having diabetes. And 5 to 10% of the patients, those who are having a very high reading, more than 180/100 or 190/100, that is called hypertensive crisis. Such patients should be managed with the expert's opinion. Last but the most important thing is our medication. Once the doctor has diagnosed that your hypertension is there, he is maintaining all the 3 or 4 sitting, lying down and standing blood pressures taken, and all the average is above 140/90 or 150/90, then a minimum dose should be prescribed. Mind you, whenever we are diagnosing a blood pressure, it is our duty to achieve a target of 120/80 or 130/80. For that, it is a protocol that we can have a 1 or 2 or 3 or 4 medication as per the requirement. Once we are taking a patient of blood pressure, it is our duty to maintain their blood pressure within a span of 3 months. That means gradual and static increase of antihypertensive drug must be there. And very important is we have to teach them that lifestyle modification is very important, salt reduction is very important, isotonic and isometric exercise should be part of our game, yoga, medication and all the relaxation practices should be there. But still, if the doctor is prescribing a medicine like calcium channel blocker or diuretics, ACE inhibitors, ARBs or beta blocker, these are the 5 most commonly used antihypertensive categories, and they are very useful and they are life saving in most of the time. Mind you dear, for ladies also in pregnancy, hypertensions are very common in 30 to 40 years. Most of this hypertension can be very well managed, and around 1/3 of them they continue as the hypertension, but 2/3 of them they are not in future, they are well maintained, so they are becoming normotensive after the hypertension episode is over. And last but the most important thing is, every patient should have a health medication prevention program. If the mother and father they are teaching the open air ground exercise or outdoor games, they are practicing low salt themselves, they teach their kids not to use alcohol and smoking, and most importantly their BMI and obesity must be maintained. Junk food, outside food should be avoided as much as possible, and practice of green vegetable and fruit intake must be encouraged. And last but not the important thing is, whenever we are prescribing a medication, it should be taken for a very long time. Mind you, hypertension cannot be cured, but it can be controlled very well. Thank you very much for your patient listening.